Some hospitals in Gauteng have been hit by water supply interruptions. Now, just last week, we heard how there were also some supply issues. For example, in Tshwane, as residents were asked to use water sparingly because things were getting out of control there in terms of the water supply. So let's get an update on how the hospitals are doing. Motalatale Modiba is Gauteng Health Spokesperson and joins us live now. Thank you so much for your time, Motalatale. The reports are suggesting that it's 3 hospitals. Is it still 3 who are impacted?
Yes, we still have 3 hospitals that are still impacted, although the water supply is stable, but we were not out of the woods yet in terms of the problem that we've been experiencing. 3 facilities, it's Rahima Musa, it's Helen Joseph, and Pulosong Hospital, which is in Ekurhuleni. The other 2 are in Johannesburg. With regard to Rahima Musa, there is still that intermittent supply at the facility. We're relying on roving water tankers from Joburg and obviously the in-house borehole that we have. The clinical areas continue to render services to patients. And with regard to Helen Joseph, they've got good pressure because the Joburg water was able to connect the institution through the Brixton Tower, which is obviously an emergency connection there, because they are on the same line with Rahima. The only difference is that they have an advantage of being closer to the Brixton Tower, and therefore they were able to connect them through the Brixton Tower. So at the moment, they've got enough pressure to keep things running in the facility. And then whereas at Pulosong Hospital, the municipality started this morning to send through water tankers that have been supplying the facility. The facility on its own had already contracted contractors to actually bring water to the facility through tankers. So in that respect, we services are continuing in terms of the stability, but we are obviously monitoring the situation closely because we are not yet being fed through your normal pipelines.
Yeah. So would you say that these are normal services that have, that continue, or have there been an impact into some of the services in these hospitals?
Look, the services that the normal, we've tried to make sure that services continue as normal as possible. The clinical areas continue to render services as normal. What we're doing obviously is that the clinicians are always having to assess to make sure that where there's a need to maybe postpone elective surgeries, they will then make that particular call. But as much as possible, we're continuing to render services. With Pulosong, as much as there are being there's water tankers that are coming through, at least they've got they've been able to sustain the services. And then with Helen Joseph, since yesterday, they have been continuing rendering services normally as they are now connected through the Brixton Tower.
Yeah.
But it's a situation that we continue to monitor. The one thing that maybe we need to mention is that the situation that we are facing, we do have reservoirs and tankers and in some instances boreholes at our facilities. But these are what you call emergency measures. They're not measures that can allow you to operate indefinitely without your normal supply. So at the moment, we're able to utilize that to be able to increase the supply. And where possible, I mean, if I just give an example, and Helen Joseph, I think they've got about 3 water tankers at the facility with a total capacity of about 260,000 liters. And they've got a borehole which is able to give them about 800 liters of water intermittently, which then tells you that obviously would not be enough. There are plans with regard to Helen Joseph to actually, they've identified a site within the facility where plans are to build a reservoir that can give them 1 mega, which is 1 million liters, that then will be able to sustain them for much longer. With Rahima Musa, they do also have some bit of capacity within. I think their total capacity in terms of their facilities is about 520,000 liters that they have. Their borehole can give them more or less about 13,000 liters. With Pulosong, as we speak now, we are currently actually building a 500,000 liter reservoir, which should be completed by end of October. They currently do have about 160,000 liter capacity reservoir. These are interventions and measures that we're putting in place, but the reality of the matter is that it's not measures that are going to, if we have indefinite challenges, that are going to help us to sustain services, say, for example, for a full 2-3 weeks without the normal supply. We need that normal supply, and that's why we are constantly engaging with local authorities. We are also engaging with the water utilities, both Rand Water, Joburg Water, to see how we mitigate and what other plans they are able to assist. And where possible, I know that they've made some contingency measures in terms of consistently supplying our facilities with water tankers, but it is a precarious situation at the moment. But services are continuing, as I said earlier, that we do have at least stable supply at the moment.
All right, and you've answered my final question there, because I was worried that should things continue this way or get worse, will you be able to cope as Gauteng Health when it comes to the hospitals? And you say that it's important to still have that stable supply, which then makes things a little easier. But thank you so much, Motalatale, and we'll continue to monitor this and check if things are getting better in these various healthcare facilities.